All right, class, week 6 already. Can't believe it. Gonna get straight into it here. There is quite a bit to cover. I am doing option 1, and as all of my other videos, I will be posting the references just below the YouTube link for my video. Um, so we're gonna be talking about anticholinergic. There's gonna be so many tongue twisters in this one. And extra pyramidal side effects. Um, so we're going to talk about how these specific symptoms, a little bit about the symptoms themselves, and a little bit about symptoms of schizophrenia and other psychotic disorders, and how they can be confusing to a clinician and be mistaken for one for the other. So right off the bat, in schizophrenia and some other psychotic disorders, there's such an incredible amount of symptoms that they're all grouped into four different categories, four main categories. There is positive symptoms, and these can be hallucinations, delusions, so really kind of an addition of something, disorganized behavior, all that sort of stuff. And there are negative symptoms, and this is kind of a removal of something or a deficiency of something, if you will. Some of these could be amotivation, a lack of motivation, poverty of speech, or just atypical for that particular individual, poverty of thought content, kind of like a social withdrawal, poor hygiene, and ambivalence, this sort of thing there. Then there's also cognitive symptoms, and that pretty straightforward there, mostly logical functions that does not coincide with that particular person's day-to-day cognitive function. And the fourth being mood symptoms. And these, again, are pretty straightforward. They can exhibit symptoms of depression, anxiety, agitation. They can include insomnia, irritability, um, all of that there. And so now that we established that, let's get into the other two sets of side effects that can come from antipsychotic medications. There are a myriad of different antipsychotic medications, multiple different generations of them. They've been coming out over the years, over the last several decades. And they all present with different side effects. The two main groupings of these side effects that I came across in the references that I'll be listing are anticholinergic side effects, and these could be dry mouth, blurred vision, constipation, so some gastrointestinal stuff, urinary retention, some cognitive impairments as well, confusion, issues with memory, um, and there is also extra pyramidal side effects as well. And these are so many as well. Uh, there's there's so many different areas that they kind of split them into categories. So the four main categories of extrapyramidal side effects. Apologies if I'm pronouncing these things a little bit incorrectly. But the four main groups are going to be Parkinsonism, um, Parkinsonism, dystonia, akathisia, and tardive dyskinesia. So with these, with Parkinsonism, you get a lot of kind of muscular agitation, tremors in the hands and arms specifically. You end up getting loss of attention, a lack of pleasure, a lack of motivation. Affect just kind of drops and becomes a little more stagnant. Again, with the social withdrawal, you're already starting to see some of the parallels here of these. And impoverished thought, once again, another one that can resemble depression or, again, the negative symptoms of schizophrenia. So we're already starting to see some parallels here. In dystonia, that's essentially just muscle spasms, but it can be severe muscle spasms, and it can actually be, this category of side effects can actually be life-threatening. Akathisia, that's really easy to confuse with agitation or anxiety. You get a ton of restlessness. The article mentions a inner restlessness, just this ceaseless inability to remain still, excessive pacing back and forth. And then a fourth is tardive dyskinesia. Um, and these are involuntary movements. My understanding is that this is likely related to the relationship with dopamine and schizophrenia. Dopamine is also responsible for movement and all that, but um, that's just that's my perspective. I'm not quoting anything. I didn't get that from the readings. Um, but anywho, this can be irreversible, so super duper dangerous. So important to be hyper vigilant with this. And it can ease with relaxation. These are some ways that you can pay attention to it and see what it is, to identify it more accurately, rather. Um, and it upticks during arousal, and it completely ceases. It completely stops with sleep. Um, so essentially, how to tell the difference of these. Um, a lot of these. A lot of it is really just understanding this literature, remembering this literature, being up to date with this literature, and looking at the literature and the studies of each and every medication, keeping an eye on the medication. Some of these recommendations I'm going to skip over because I will cover them again in this next section. Um, so, talking a little bit about neuroleptic malignant syndrome, that is a super rare and potentially it could be fatal as well. And they also come from antipsychotic medications. And the some of the biggest symptoms of these are going to be extremely high fever, again with the kind of muscle rigidity, cognitive impairments, anything ranging from brain fog, if you will, all the way to coma, autonomic dysfunction, heart palpitations, rapid heartbeat, extreme changes in blood pressure, lots of sweating and um, that physical realm there. So what does this mean? What are the implications for a clinician? Um, so much. It means that you have a client that may be going to because of schizophrenia, but all of a sudden you have to now pay attention to all these symptoms of the medication. Not only are you now responsible ethically and professionally um, to understand the potential side effects of all of these different medications. Sometimes there's a slew of medications. It's a long-winded process to go from one to the other. You now have to be aware of these life-threatening syndromes that can happen, some that are irreversible and fatal. So it's really important to for both, not both rather, the anticholinergic side effects, toxicity, the extrapyramidal symptoms, um, everything that we've talked about so far. You have to really pay attention to when this client started medication X. Be familiar with that particular medication. Look at their medical history. Are these symptoms that you're maybe noticing in session? Are these or that's being reported to you? Are these symptoms that have happened in this client's history? Is this typical? Have they had a history of depression? Have they had a history of anxiety? So you kind of you cross-reference and you deduce and you check all these things, and again, recognizing as MST and PCC is the direction that I'm in, recognizing my scope of competence, and relying on active and thorough communication with the psychiatrist. You might be spending a lot more time with this client or patient than the psychiatrist is. And these can be immediate side effects that can be either irreversible or fatal. And so it really is a lot of weight here. Um, and yeah, I think the biggest thing is being aware of the literature and having active communication, and second guessing, third guessing, and just checking for everything, because this is serious stuff. All right, that essentially grabs all of it. I'm already at 10 minutes, so I'm gonna go ahead and stop the video. Thanks for watching.